Colonoscopy is a fiber optic endoscopy procedure, a camera examination, which allows us to look at the colon, which is also called the large intestine, and it is the gold standard investigation to look at this area. It's very important because it's an area where things go wrong, and obviously people are well aware of the possibility of bowel cancer, which is one of the main reasons why we do this examination. Colonoscopy, first and foremost, is a diagnostic test, so it actually allows us to find abnormalities in the bowel, bowel cancers, polyps, other benign bowel conditions like diverticular disease. However, it also does have a therapeutic role, and the main thing that colonoscopy allows us to actually treat are polyps, which are common finding in the bowel, and they are frequently precancerous, so it's very important that when we find them that we're able to remove them. The vast majority of polyps can be taken out by colonoscopy. So the signs that are most important and that would lead on to investigation of the colon by colonoscopy are, first and foremost, a change in bowel pattern, and the type of change in bowel pattern that for us is considered most important is when the bowel content becomes looser and more frequent than normal. If this is associated with another important symptom, which is bleeding from the bowel, and that may be blood that's actually visible, or it may be blood that's detected by special, very sensitive tests to look for microscopic traces of blood in the stool, well, that's a very important symptom. And the other things that occasionally can lead on to colonoscopy are cases of various types of abdominal pain and sometimes weight loss as well. Colonoscopy shouldn't be a painful procedure, and for the vast majority of people, it's actually a fairly straightforward affair. Most people have a colonoscopy under a combination of intravenous sedation and sometimes inhaled sedative, which is called Entonox. If you have a colonoscopy under these sorts of sedation, most people have a very good experience with it, and in fact rarely actually have any memory of it, because there is quite a strong amnesic effect to the sedatives that are given. Again, most people are awake during colonoscopy. There are many people that choose to have colonoscopy without any form of sedation at all, and even if you have it done under intravenous sedation, it is what we call awake sedation. So the idea is that you're aware of what's going on around you, but you are comfortable. And because the procedure sometimes demands that as a patient you change position, you may be lying on your left side, but there are times where it's beneficial to be lying on your back. It's far easier if you're actually awake rather than very heavily sedated or even under anaesthetic. There are rare cases where people find colonoscopy so difficult that they have to have a general anaesthetic, but they are very much the exception. A recovery from colonoscopy is usually very quick, and it depends entirely upon the nature of the sedation that's used. If you have no sedation, you recover from it almost immediately afterwards. You may have a little residual bloating within the abdomen, but that normally settles down very quickly. If you have a bit of intravenous sedation, then before you leave the endoscopy department, we like to ensure that you're sufficiently recovered and able to walk unassisted, although you would still not be able to drive yourself home. You'd have to be accompanied by somebody responsible who would also stay with you for several hours after the procedure.